Hello everybody, my name is Dina. I'm a primary therapist at Evolutions Treatment Center. I studied at the University of Central Florida with my degree in clinical mental health counseling, and I've always loved psychology, working with people, helping others in recovery. I've gone through my own therapy, which has given me that insight to sit in the opposite chair from a therapist, so I know from a client's standpoint how it feels. And I've always wanted to contribute and give back to others. So here I am. I've been working with severe and persistent mental illness population for about 2 years now. And now I'm doing co-occurring disorders with addiction and recovery. So I wanted to give a little intro lesson on emotional acceptance technique and what's called the window of tolerance. So in your window of tolerance, that's basically like your optimal functioning, where you can merge reasoning and emotions. And often when we are conflicted with emotions and have been through a lot of pain and trauma, we can either become hyper aroused, which is feelings of anxiety, overwhelm, acting out, and then there's hypo-aroused, which is feelings of shutdown, withdrawal, numbness, disconnection. So in those two states, it's really hard to regulate and reason with your thoughts and emotions. And in recovery, I teach the importance of acknowledging your emotions, identifying them, and accepting them. So with this technique of acceptance commitment therapy, there's 4 steps. You want to first observe how you're feeling. So I have a feelings chart, and you can identify how you're feeling, if you're feeling nervous, and just identify it, observe it in the background. Instead of actually experiencing it, just observe it. That's the first step. Then we want to practice breathing to get us out from the hyperarousal and out of the hypoarousal back to our window of tolerance. So once we do some deep breathing, while observing without judging the emotion, we want to go to expand. We want to create space for this emotion. So we'll say things like, I notice that I'm feeling nervous, instead of I am nervous. Gives you some space. And while you're breathing and not judging it, you want to lastly allow. This is a really hard step, but this is the practice of allowing the emotion to be and letting it pass, making room for it, and saying something like, this is unpleasant, but I can handle it. Instead of getting wrapped up in continuing the cycle of hypoarousal or hyperarousal, we want to allow it to be so that you can get into this window of tolerance and have a great merge between your emotions and your reasoning. So that's it. I hope you can use that and accept your emotions.